Hello, my name is Shalise, and I'm your host for the webinar today on vitamin D and the immune system. We all know vitamin D is important to our health, but did you also know that vitamin D has major effects on our immune system by controlling gene expression in our DNA? Whether you're a researcher, a doctor, or just someone interested in health listening today, you will find this information in this webinar valuable and relative to what's going on in our world right now. Our teacher today, Dr. Paul Frank, has lectured all over the country for doctors on many different nutritional topics, and he's presenting this special lecture today on vitamin D because he believes this information is so valuable for those looking for ways to support their immune systems at this time. Dr. Frank loves finding content from the most current research on the topics he teaches, and his slides are referenced throughout. If you want to review any of these subtopics in more detail that are mentioned in the webinar, please feel free to take advantage of the references. And just to get us started, I'm going to read through our disclaimer first. The content of this production is intended solely for healthcare practitioners for educational purposes only. Information set forth herein is holistic in nature, is not offered as a complete or comprehensive training on all subjects referenced, has not been evaluated by the Food and Drug Administration or any other medical body, and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information, with the expectation that practitioners shall use their own discretion, perform their own research, rely on their own clinical experience, and practice according to their scope of practice and the limits of their license. And now, without further ado, Dr. Paul Frank.
Well, thank you, Shalise. And we're going to have a good time today. We're going to go over a lot of research and hopefully make it really easy to understand. Now, this is taped April 2020, so just realize that probably in another year or two, all of this information is going to be a little outdated because as you'll see, there's going to be a lot of changes in vitamin D and how we look at it in the future. Well, again, we're looking at a vitamin D epidemic because more than 1 billion people worldwide are believed to have a vitamin D deficiency. So we're going to really dive into this, current state of affairs today. Everybody's worried, about their immune system and wants to make sure that they are doing the best things for it. So that's really why we're going over it today. Now, overview, will vitamin D increase survival with lung and viral or bacterial infections? So we're going to go over a lot of the research and hopefully you'll understand exactly how that could, help, how vitamin D would help. Will vitamin D help with acute respiratory distress syndrome? So then if the viral infection goes farther and you're not fighting it adequately, then you'll go into acute respiratory distress syndrome. And so we'll talk about what that is and how vitamin D would possibly help with that. We're going to talk about how vitamin D works and what blood levels are necessary for maximum gene expression. Now we have the ability to look at gene expression, and what we're finding out is that the blood levels are not necessarily equating to maximum gene expression. So really the most important part of this video is going to be going over what dosage gets, the gene expression and why we might be all inadequate with our vitamin D intake. How much vitamin D do I take? So we're going to kind of go over that. And then when does vitamin D not work? We're going to look at a lot of nutrients that if you're not taking in these other nutrients, vitamin D is not effective. And also, if you're not dosing it properly, if you're using the wrong form, there's a lot of things. If you're taking a drug that degrades vitamin D, then that's going to affect you as well. So here we go. Now, what I want to do is start with what did we learn in school? So, if you're a medical profession out there, I want to start out with what we learned in school. And if this is new to you, this will be just kind of an opening. Well, 1822, they recognized association between lack of sunlight and rickets. And rickets is just when your bone does not lay down calcium, so they start to bow when you stand up. Okay. 1919 successfully cured rickets. 3 months exposure to ultraviolet radiation, okay? Connection between exposure to sunlight or artificial UV radiation and the cure of rickets led to the concept of, well, let's irradiate all these foods and see what happens. So they found that irradiating milk can support rickets by creating the provitamin D. So then they started actually irradiating milk because it's got cholesterol into it, and the irradiation turns cholesterol into the vitamin D. So let's look over here, just kind of give you a background. Over here, whether the sun produces vitamin D in the skin from your cholesterol and it comes into the blood, or you take it through food. Okay, either way, you're getting vitamin D. Now, the one thing you have to understand is vitamin D comes to the liver first. It's changed to this 25-OH, or this, so it goes from vitamin D to 25-OH. And just remember that, because we're going to talk about this is what is actually measured in the blood. So I want you to be real familiar with that, but it's inactive for the most part. So we're measuring the inactive. Then it comes to the kidney, and it will be changed to 125-OH. And this is actually a hormone. So it goes from vitamin D precursor to hormone. That's what allows calcium to come in the body and be laid down in the bones so that the bones have compact resistance. And then this is what we learned in school, and I learned it 20 years ago, and we sort of lost track of vitamin D because, gosh, all things are fortified, so you really don't have to mess with it. Now, I want to go back and understand why was vitamin D not studied way back there? If we're just now finding out today what's going on with it, how come we didn't know that back then? Well, we need just a slight history lesson. Back 400 BC, heliotherapy was created by Hippocrates, and he noticed a lot of benefits from getting sunlight. So it started really there. The father of medicine started. And then in the mid-1900s, they were using light therapy for tuberculosis, lupus, psoriasis, and all sorts of conditions. And then even today we use light therapy. So why is this not really thoroughly researched out? Well, we'll understand if we understand a little bit more on the history. By the year 1933, over 165 different diseases for which sunlight proved to be beneficial for treatment. We're talking things like infectious diseases, lower blood pressure, lower blood sugar, increased number of white blood cells, asthma, arterial sclerosis, and rheumatoid arthritis. Now, back then, it would seem kind of preposterous that, you know, it would help with these things. So that in growing power of the pharmaceutical industry, heliotherapy or light therapy fell into disuse. 1960s, the miracle drugs, all the antibiotics and everything came out. So there was no need to really, look at the sun anymore. And by the 1980s, everybody was so scared of sunbathing that, the risk of cancer and all that. So this really kept it out of the limelight for, probably 75, 80 years. So why did vitamin D make a comeback? Well, increasing cost of antibiotics, according to the research, rise in antibiotic resistance, okay? Increasing incidence of multiple drug resistance, MDR, and extreme drug resistance. Then they said, well, wait a minute. Don't we remember that vitamin D had an effect on maybe the immune system? Let's, look into that further, because all these problems that, happen later on down the road. So you'll see this, there's no research basically from the 1950s all the way up to 2000, not a whole lot of research. And all of a sudden this skyrocketing. So why did it skyrocket? Well, mainly these next two reasons. Health benefits. Vitamin D regulates up to 5% of the human genome. Well, if you can regulate that much of the human genome, it's probably beneficial. So, and also it regulates 291 genes. This is back in 2015. Now we know about maybe up to 2,000. 160 distinct biological pathways. So you think it might be important? Yeah, it may be important. Here's the second piece of information that they thought, oh, this must be important, because they found vitamin D receptors in a lot of other places besides the intestines. So we have liver, we have the immune system, the lungs, muscles like the heart, thymus, spleen, adrenals, the brain, the prostate. So if there's a vitamin D receptor that pulls in vitamin D and they're in all these different tissues, you might think, there might be a benefit to vitamin D and not just for the intestines. So I'm going to go over briefly the new model. So the sun, so let's make it from the skin. So the UV light comes in, okay, UVB, and it comes in, and it's the UVB is what burns you. So you can't get too much of it. And then there's also this UVA. Now the UVA will come in, and that will cause skin breakdown because it gets in deeper into the dermis and it will cause DNA damage. Okay, so we want more of the UVB coming in. Now again, it hasn't really changed much. You come in as vitamin D, cholecalciferol, and then it will be changed to the 25-OH or calcidiol. Now, what's important is it comes down here, it can be changed to the active in the kidneys, but there's a lot of other tissues that will change it to the active, and that'll become important here in a little while. But here's what's really important about it is that when vitamin D, the hormone, comes in, it attaches to the vitamin D receptor and vitamin A. So we're going to find out why that's real important later. It comes in and it allows your DNA to be expressed, or it opens it up and it allows it to be read and you duplicate it onto RNA. But all you really need to know is you make a lot of compounds that are going to be beneficial to your body. And for example, it helps with DNA repair. So the UVA coming in, the vitamin D, helps with the repair. So it's kind of a neat mechanism related to the skin. How does vitamin D have so many beneficial effects, or why? Why does it have so many? Well, here's the brain. In the brain, the same thing happens. So you bring in the hormone, the 125, in, and vitamin D receptor with vitamin A, and it turns on all the machinery in the pro-survival machinery in the brain. So you get maybe formation of serotonin, helps with depression, controls inflammation, helps the mitochondria. Basically, all the mitochondria they produce about 90% of your energy. So your brain needs a lot of energy. So when you turn on this machinery with the use of the hormone, it actually benefits greatly the human body. So this helps with depression. Again, the same mechanism for Alzheimer's disease and cognition. So, the diseases all kind of look the same after a while because you're turning on the same machinery. The vitamin D comes into the cell, gets into the nucleus, and it transcribes, up to 1,000 regulatory genes in the brain that it helps regulate and things function better. So same mechanism. And I'm just going to do one more just to drive this point home, but vitamin D normalizes genetic expression in blood vessels. Same thing, the 125, the active hormone, can come in and then it can turn on the DNA and produce all these beneficial compounds that angiogenesis, that's building more blood vessels, inflammation, decreasing inflammation, that's good for the blood vessels, and all of these other things basically benefit all your blood vessels and lead to overall disease conditions that are either improved or prevented. So when we look at this hypertension, anti-inflammatory, vascular tone, lipid lowering effect, all of these things from vitamin D, it's not because it's treating it like a drug, it is actually changing DNA expression and allowing your body to function at a higher level. And one more thing I want to say on this is vitamin D and the mitochondria. Now, if you don't know what the mitochondria are, basically they produce all of your energy, or 90% of it. And so you want to have the mitochondria function at peak level, especially if you're trying to avoid aging quickly. So by giving vitamin D, it has an effect on the mitochondria itself. So one thing, it promotes removal of dysfunctional mitochondria. So yeah, if they're not working, get them out of there. If they're working, but just not at peak performance, you increase the function of the ones that need to produce more ATP or energy for us. Reduces oxidative stress. Again, oxidative stress destroys your mitochondria. Decreases inflammation. Inflammation is related to a lot of different diseases. And then decreases telomere shortening. You want your telomeres to be very long. So I don't have time to get into any of this other than to say that vitamin D helps with the overall aging process. Vitamin D levels, so it wouldn't be too far of a leap when they found out this, that longevity is a side effect of adequate vitamin D levels. So down here, 30 to 30 nanograms per milliliter, that's where you start to level out and you get better benefit from having your levels here. Now, if you go down into below 30, down to 20, down to anywhere down in here, then your all-cause mortality seems to go up. So it only makes sense that having good vitamin D levels throughout your lifetime would be a more than likely a beneficial outcomes. Now, before we go any further, I want to make this point very clear because, sometimes I'll say to a patient, well, if you take vitamin D, it'll boost your immune system, because I'm just trying to get the point across. And, I don't want to go into a lot of detail. And the patient will say, oh my gosh, doc, I can't take vitamin D then because I've got rheumatoid arthritis or MS or something that, I don't want to ramp up my immune system or it'll make things worse. So before we go on, I want to show that vitamin D doesn't boost the immune system, it regulates it and it normalizes it. Here's what I mean. This is some great research by Pollock, I believe. He came along and he said, these genes were turned on, okay? We gave vitamin D and it turned those off. Okay, that's kind of strange. You would think it would just turn them all on. Well, it turns some off. They're blue, so they're colder. Not as much heat, less activity. Then you come over here on this side, these genes were turned off. With vitamin D, they turn on. So wow, some are turned on, some are turned on, some are turned off with vitamin D. And we're going to see why this is very beneficial. So if you may want to turn some off because you want to decrease inflammation, or you may want to turn some on so you want to fight an infection better. And we'll see why this is really relevant for overall better state of health, less disease. So now I want to focus on the lungs because everybody's worried about their lungs in today's age of fighting lower respiratory tract viruses. So we're going to go over the ability to fight disease is improved with vitamin D, prevent disease, improve with vitamin D, and create normal lung development. We'll see why this is I'm going to use asthma as the example, but we'll see why this is very important to develop good lungs in the first place. This is probably one of the most important slides I've got. This shows up here at the top, all of this is the benefits without vitamin D of fighting rhinovirus, RSV, or influenza. You can still fight a virus infection without vitamin D. So it's not necessary, but then I'm going to show you what happens when you treat with when you take vitamin D in. So first, let's start with the basal conditioner, the beginning point. So it will ramp up parts of your immune system that will allow you to fight a virus much more effectively, okay? And so it does this in a different way for different types of viruses. So not all of them, it's not, one size fits all. It ramps up differently. Okay, that's without vitamin D, but just know that you can still ramp it up. Now, vitamin D treatment, okay, it ramps up these compounds even to a greater extent, which gives you a greater ability to fight that virus. These, again, are ramped up. So you have better viral replication. You decrease the viral replication, which gets it out of your system a lot faster, which is what you want to do. You want to fight these viruses before you even know you have them, because what happens is if you're not fighting it effectively or efficiently, what happens, you can get an overproduction of these cytokines and everything else that can cause a cytokine storm and your immune system to go haywire and actually cause an overshoot of your inflammation stages. And then that's not good for you. That's called immunopathology. It's a pathology created by your immune system. You want to dampen that. So vitamin D dampens that. It dampens a different set for each virus. But basically, you want to be able to turn it on strong, and shut it off when you need to shut it off. And that's what vitamin D apparently seems to be very good at doing. So before we go on, I want to kind of a brief overview of things like ARD, sepsis, septic shock, and systemic inflammatory response syndrome, so that when we look at the research, all of us are on the same page, whether you have a big medical background or not. So these are the air sacs, or the alveoli spaces where you bring the oxygen down into the lung. Now, you can obviously see if you've got liquid down here from fighting an infection, we call that pneumonia, the inflammation with the liquid in there, that's pneumonia, and you're not going to get good gas exchange. So let me blow this picture up and go into a little better detail. So here's a normal alveoli. Now, normally it's held open by something called surfactant produces along here. It basically repels this against this, and it stays open like a balloon. And when the air comes down in, the oxygen comes in, the carbon dioxide comes out. So ventilation brings it down, and then perfusion brings it over into the red blood cells. Now, in an infection, what happens is you start getting leaky areas that bring in fluid into this area, into the lung, and you're fighting an infection in here. You're killing off all these viruses, and you're killing off some white blood cells, and that creates toxic load. So first thing that usually happens is a life-threatening acute respiratory distress syndrome, because simply put, if you're not producing surfactant and these are collapsing, you can't get good air down here. So they put you on a ventilator and they push air down in here to open these up, okay? Sepsis is basically all this garbage getting into the blood and causing toxins in the blood. So that septic shock is where the blood becomes so toxic that it causes dilation of the blood vessels, and you lose blood pressure when you have dilation, and that's a big problem. You want to be in the hospital if you go into septic shock. And systemic inflammatory response syndrome, well, think about it. You're putting all these toxins into the blood, and it's going all over the body. So wherever it goes, you're going to feel achy, your bones are going to hurt, everything's going to hurt because you've got all this. So my point is, you want to fight all this before it gets into this. You want to fight it as much as you can on your own. And the more vitamin D is on board, probably the more you're going to fight this on your knee and need less intervention medically. So now we're going to look at the research now that we have some background. Influenza, upper respiratory tract infection, vitamin D supplementation may have a preventative effect against an upper respiratory infection. So upper respiratory is like up in your nose, in your schnoz. So yeah, it might prevent that. You see, if you kick in the machinery and the DNA that has your own immune system fight more effectively, that just makes sense that it's going to be that way. Now, conclusion from this one, protection against acute respiratory tract infection overall. So both an upper, your nose and your lungs down in here. So your overall, you're going to be better off by having your vitamin D levels higher in the blood. Do you see why? Because you can fight it off more effectively. Now here's one showing that increased use of antimicrobials with a vitamin D deficiency. Well, doesn't it make sense? If you can't fight an infection and win the war really quick, then it's going to overcome and take over, and you're going to need some help. So you're going to need to bring antibiotics on board to start killing some of these, because what happens, you get a primary lung infection with maybe a virus, and then you get all this protein down in here, and then the bacteria moves in and feeds on this stuff. So you get a secondary bacterial infection. So less microbial use if you're fighting the infection better yourself with adequate vitamin D. Increase the risk of multiple respiratory infections are associated with low vitamin D levels. Okay, now, what if you go into the hospital? Vitamin D deficiency prior to entering the hospital is associated with development of acute respiratory failure. Yeah, if you don't have vitamin D on board, you get to the hospital and they have a less chance of maybe saving you. So vitamin D deficient patients who develop acute respiratory failure have heightened mortality. So do you see, even if you do all the great life-saving things they can do in the hospital today, you still might not make it if you don't have adequate vitamin D on fighting this for yourself. So you want to combine the two together. Vitamin D decreases hospital length of stay. Do you see, if you're fighting it yourself, you're going to need less intervention to get out of the hospital, and you're going to get better quicker. Vitamin D deficiency is common in people who develop ARDS. So yeah, acute respiratory distress, you're going to develop it a lot more chance of developing it if you are not fighting the virus effectively yourself. So here, to end with, relationship between vitamin D deficiency and inflammation. Okay, so if you have your vitamin D levels up, then you're turning on your genetic potential and you're fighting the virus better yourself. So you have less sepsis, less septic shock, less systemic inflammatory response syndrome, if your levels are higher. Now, if this is all things equal, now, you know, if you have all the comorbidities and your levels might still be up and you might still have problems, but basically, if you're healthy and this is higher, you've got a better chance of survival. Now, consumption of vitamin D supplements might be helpful in decreasing the prevalence of infections, sepsis, and mortality caused by it, especially in the older age. So yeah, if you're older, you have less of a chance of fighting the infection yourself. So you want to be able to ramp your own immune system up, and anybody else is probably going to be better off when your vitamin D's is in the level, and I'm going to say in the level of turning on DNA expression. And I'm going to show you in a minute that that's not necessarily related to your blood lab levels. So now let's look at this 2020, got a little pandemic going on here. They looked at, I think, 3 hospitals, and in I believe it was China, and they looked at vitamin D levels and the severity. So mild clinical pneumonia diagnosis, ordinary, confirmed pneumonia in the chest, you have a fever and you feel a lot worse. Severe, you're going hypoxic or less oxygen in the blood, okay? So you're not getting good gas exchange, or, you know, a lot of other things could be causing that. So you're going downhill. Okay, they may need to put you on a ventilator to save you. And critical, you are on a ventilator and you may not make it. So that would be kind of critical. Now look at this, mild 31.2 in the blood is the level. Now at this point, the numbers don't mean much, but just know that the bigger the number, the higher the vitamin D precursor or the inactive in the blood. 27, you're getting worse. Severe cases, 21, or critical, 17. So this is suggestive of if you go to the hospital or you're fighting this, you want to have higher level. Now I'm going to show you this 31 is way too low. I'm surprised you're seeing this, but at any rate, we're going to look at what levels you need to get to be more protected than this. I don't look at this as being very protected at all. But all in all, this research kind of comes out and says, you know, vitamin D is to the immune system as a pro-survival molecule. So it's not treating anything. It's not, it's just allowing you to fight whatever viruses come in a lot more effectively. So getting your vitamin D levels up would suggest that you're probably going to have a better time to fight anything that comes at you, you know, in considering a viral infection. So now what I want to do is look at the lung related to asthma, because the same machinery that you turn on for a viral infection is turned on for an asthma, and we'll see how that helps with asthma. But more importantly, not with asthma, I want to show that uterine development is where we need to be thinking about vitamin D, and I'll show you why. Vitamin D supplementation reduced the rate of asthma exacerbation. Again, I'm putting all the research down here. You can look this up free, get more out of this, but I'm just hitting the highlights. Requiring less treatment with corticosteroids. Why? Well, look over here. You have the bronchioles here, and there's smooth muscle in there. So when they get inflamed, they clamp down. So you can't get the air from your schnoz all the way down into your alveoli. So you can't have gas exchange. So that can become critical. But the same mechanism of down regulating an overactive immune response that's detrimental is a good idea. So definitely you want to have your levels up high enough to where you can have an effective response in normalizing an overactive immune reaction. Now, we're looking at asthmatics that are, you know, already grown, and we're looking at, okay, can we put in vitamin D and have an effect? But really, that's not a very good idea, because, and here's why, because in utero, you are developing your lungs, okay? Your lung maturation, surfactant production, you know, keep the alveoli open, and immune development. So you are developing. So what if you have vitamin D deficiency here? Are you going to build as strong a lungs, a strong immune system? So really coming in here like almost like a drug and throwing this vitamin D and trying to you know, ramp up these responses, you know, you may or may not have good results with that. But the best time is down here when you're building. So I recommend that you have your adequate levels here, not wait till you're here. You're going to get a lot better results. So, and I'm going to use this I'm going to promote this website because I think it's really good. If you don't have a good way to get your blood vitamin D taken, you can go to this Grassroots Health, and they're a nonprofit organization. I think it's like $65 to run your vitamin D level. And so I highly recommend going to their website. They have a lot of great slides that I'm even using in my card deck because they're just, they're phenomenal. So I definitely want to plug them. Now, here's the reason for the mother taking vitamin D. And notice they want levels above 40. We're going to find out why, because the RDA says, oh, if you're around 30, 20 to 30, you're good. Really, you might want to be a little above this because you want it to spill over into the to the fetus. And there's some really good research around there, and you can look her up, and she does some phenomenal job. But 6,400 IUs a day for a pregnant mother, and that's also going to have a benefit for the child. Okay, and you can read through those if you want. But I'm basically trying to say rickets is just tip of the iceberg. All of these things. This is why you want to have higher levels than during pregnancy, and most pregnancy prenatals are very sufficient, and we'll get into that here in a minute. So other nutrient deficiencies, when will vitamin D not work? Now this is really important, especially if you're a researcher, because if you don't set up the right research, you can come to false conclusions. And I've seen that a lot lately. If well, we'll go over some examples. Other nutrient deficiencies, drugs that block the action of vitamin D or break it down. If you're taking a drug that breaks down vitamin D and you're wondering, well, why am I not getting any better? Well, it's because you're on certain drugs. If the research design is faulty, so you might come to a bad conclusion, say, well, gosh, I don't want to take vitamin D because I read this research that says that vitamin D is not effective. So after this, I think we'll understand how to at least look at research design a little more critically. Now, the first thing I want to say is, remember I gave that little tidbit of vitamin A is needed with vitamin D to get DNA expression. Now, I don't think it's any stretch of the imagination why a lot of vitamin A deficiency will lead to cancers, and a lot of the same things vitamin D will look at. So if you're deficient in vitamin A, vitamin D cannot do what it's supposed to do. So they're needed in synergy. Now, what if you're creating a research project and all your subjects are deficient in vitamin A? Okay, vitamin D might not work. So your conclusion, you might have a confounding variable that gives you a wrong conclusion. So be wary of that. Now the next one, magnesium in vitamin D activation. Now to get from the vitamin to the precursor, the 25-OH, you need magnesium, okay? And most people are deficient in magnesium, and you might say, well, gosh, I had my magnesiums drawn and they're okay. Well, you can have normal in the blood and your tissues are severely deficient. So that's why probably most of us are deficient in magnesium. But anyway, it goes to creating the active. So you cannot, the 125, the active, without magnesium, because magnesium is involved in like 600 different enzyme steps. This is just one of them. So to get to the vitamin D, you have to have magnesium. So it's most of the people that they're probably running through these research experiments, have they tested their magnesium levels at the tissue level? Probably not. So it's no wonder cardiovascular disease and metabolic syndrome, we see a lot of overlap between vitamin D and magnesium. Okay, next, somebody will tell me, oh yeah, I need vitamin D for the immune system. Somebody else will say, oh, I need zinc. Well, I need this or that. Well, if you look, these are the different white blood cells that you need to be functioning at optimal performance to fight viruses, bacteria. And each one needs a different set. Like this one needs vitamin E, vitamin D, probiotics. This one needs N3 fatty acids. So if your N6 is heavy, then you're not going to mount a response. And all of them are different like that. So what if you have patients that do not have these on board, and then you give a bunch of vitamin D and wonder why you're not getting good research outcomes? It's the synergy. So obviously a different model of research needs to be put together. The reductionistic model of research, it needs to be modified a little bit because you need all of them for optimum immune function. Drugs that interfere with vitamin D, some drugs interfere with vitamin D absorption because vitamin D is a fat soluble. So if you're taking a drug like lipase inhibitors where you're stopping the fat from coming in or you're not producing bile, you need bile to get fat in. You need fat to actually get in to bring in vitamin D. So you could take all the vitamin D in the world, but if you're on these drugs or if you're not absorbing, possibly you had your gallbladder out so you aren't producing as much bile acid. So a lot of different factors can affect whether you're going to be pulling it in. Then drugs that interfere, they either stop production or they break it down. Corticosteroids, anti-epileptics, immune suppressive drugs, H2 receptor blockers, all of those can actually cause a higher breakdown of vitamin D. I'm just going to use statins just because everybody is real familiar with those. But, you know, they say you want to block cholesterol production. So they come in here and the statin blocks this enzyme wonderfully. It blocks all of these compounds down here that might be beneficial for health. And so you don't produce cholesterol. Well, from cholesterol, you can't make your steroids, testosterone, and all that. You can't make bile salts. You can't make as effective vitamin D. It doesn't shut it down totally, but it does affect your ability to make cholesterol. And if you happen to have less in the skin to make vitamin D, that's going to affect you. So my point is there's a lot of things that are affecting your vitamin D levels, and also you're blocking these enzymes that mitochondrial dysfunction, it causes all the muscle pain and everything like that because you're blocking these things. So to me, cholesterol is the least of your concerns. You're blocking a lot of other stuff that will, so, definitely be careful with these drugs and only take them, when they're absolutely necessary. Okay, now what I want to do is I just want to touch on some research because, I do this all day, but basically early administration of high dose enteral vitamin D3 did not provide adequate advantage over the placebo with respect to mortality or non-fatal outcomes and all this. So then I thought, oh, well, gosh, that's a study shows that, vitamin D didn't work, and in these critical care, do you think they had magnesium and, vitamin A and all that? Probably not. But you come down here, then when I read this, I said, oh, eligible patients received a single dose. So really, in my opinion, from looking, you need to bring in, you don't want to just get the lab value up once. You want to get it up and have it continually spilling in. But look, one dose of over 500,000 international units. That's crazy. I mean, yes, it will affect the blood. But, at the end result, and then, critically ill, and then you just give one dose, and then you come to a conclusion, well, it didn't work. Maybe their research design, they should go back, and especially when we look at genetic research, you'll see where this is even more flawed. Vitamin D supplement did not reduce the incidence of influenza. So I come along something like this, and I say, oh my gosh, it didn't work. And then I look at the dosage, and 200 international units a day, and this is like the upper limit. So this is looks like a good dose. But then when you look at having DNA expression, you need to have 10,000 IUs to have good DNA expression, which is a sun dose. You get 10,000 IUs from the sun. So this is way inferior to maybe turn on the right genes. And again, do they have vitamin A levels up, magnesium, so forth. So you really need to know how to look at these research articles. So what am I talking about? Vitamin D and DNA expression. Well, we're going to have to, gosh, I hope you can see this. I'm going to move this up maybe. I'll move this over to here so you can, not that you want to see me, but okay. So down here, if we're looking at this chart, this is your blood value. Now remember, we're measuring the 25-OH. This is the inactive. Okay, and there's some reasons we're doing this, but we don't have time to go into it, but you're measuring the inactive. So down here, to prevent rickets, up to 20 nanograms per milliliter. So I would agree, if you want to prevent rickets, go by the RDA that gets you to about 20, between 20 and 30, because they've shown up to 30, you can have microscopic damage at the bone level up to 30. So that's really why the RDA is set up to 30, because again, rickets, 75 years ago, that's where they set the levels at. And but now new research coming out is showing that, wow, to get between 40 and 60 cancers all combined, breast cancer, colon cancer, type 1 diabetes, has to do with the immune system, heart attacks in men, endometrial cancer, all of these cancers, you can't be down here in the rickets range. You have to be up here, and I'm going to show you why in a minute. Why do you do better in the 40 to 60? Now, I'm going to suggest you need to actually be between 60 and 80. That's where you need, and a lot of the doctors that are really keeping up with the research, that's what they're making sure their values are at. And so you'll see why in a minute. Now, look at this. This is treat influenza, maybe some pandemic going on now. Look what they recommend. They recommend 10,000 IU of vitamin D. That seems like a high dose, but really it's not. It's what you get from the sun for a few weeks, and then raise vitamin D, and then followed by 5,000 to keep it above 40 to 60. Now, it doesn't say between 40 and 60, it says above. Why do you want to go above? Well, we're going to see here in a minute. Now, gosh, okay, I could be over here. I don't really matter in this whole thing. But so here, we're looking at the inactive in the blood. Now, we're assuming you're bringing vitamin D in, you're measuring the inactive, and you're also spilling a little over into fat storage. And we're assuming if it's between here and here that you've got adequate spillover into the cell, say the white blood cell, where it's going to change it. It actually, at the white blood cell, it'll change it from the 25-OH to the active 125-OH, and then I'll have DNA expression. So I just automatically assume that because that's what the best doctors are recommending. And the RDA is down here below 30. Okay, so they're not interested in this. They're interested in preventing rickets. But when you measure this vitamin D level, you're not measuring the active, you are measuring the 25-OH, which is the inactive. 85% is bound to vitamin D protein, so it's not available to go in the cell. 15% is bound to albumin. 0.3% is freely active to going in here. So we automatically assume when we're measuring the inactive that we're getting activity. That's what we're thinking about, is the assumption that we're all working on until now that we have this new research coming out. So what's the new research? Well, Hollick, who is one of the foremost authorities, I think, in vitamin D research, because when I went to find all the information on this, his name kept popping up as really like he knows what he's doing. So I'm gonna move this over to there. So now we're gonna look at different dosages, different blood work, and different gene expression, because now we can measure the genes, how many are turned on at what level. Now watch this, 600 IUs. Now this is what the RDA recommends, 600 to 800, I think. Then you're like really in there, not over 2,000, I think. So you go from 17. So in the rickets category, you go up to the upper end of the rickets category, but you only turn on 162 genes. So that's great. That's better than nothing. So you go from rickets to pre-rickets. That's great. I applaud that. Okay. Now you go to 4,000 international units. So the average starting was 22.5. Then you got to 40. Remember the 40 to 60 that everybody recommends? 4,000, which is double what you would give for the RDA. You're getting into the 40 on average, 320 genes expressed. Now look at this, 10,000 IU, the amount you'd get in the sun, 10,000 to 20 IUs from the sun. You go from 17.8 up to 78.6. Now at 78.6 on average, you're turning on 1,289 genes. Now let me ask you a question. If you're fighting a lower respiratory tract infection, do you want to be at 24, which is recommended with the RDA? Do Do you want to be at 40, which is most people consider 40 to 60 as a good range, and it probably is, it's better than that. Or do you want to be up here expressing all of these genes that are going to protect you and hopefully make the symptomatology a little bit less, and maybe your survival a little bit more? So my recommendation, or from the research, is suggesting that I need to get my blood lab values up. Okay, now, and then it gets a little more complicated than this. Now remember, we are measuring the inactive, and we're assuming that whatever comes in is going into the active. Well, if you are deficient, if you're obese, a lot more of it is going to go to the fat stores, and you're going to have less of this. So there, we're finding, actually, this was genius, this same Hollick. He found that even among gene expression and metabolic profile in response to the same dose of vitamin D supplementation, despite similar changes in 25-OH, this can have the same change. One person will activate a lot of genes, another person will not activate a lot of genes. Now, probably because, you know, in certain diseases, we have less vitamin D receptors that'll pull this in. That might be a factor. But again, this research just came out. So I would imagine in the next 3 years, we're going to find out a lot when they move forward with a lot of the unknowns of this research. But basically, you could have a level between 40 and 60. One person's turning all their genes on. Maybe another person is not turning their genes on. That's why I say, since it's safe, you want to be between the 60 and 80. Now, that's just my opinion based on the research today. Now, we've got a lot of research to come out on this to shed a lot of light on a lot of other things that I haven't even touched on. Okay, but my point is, measuring the blood levels of your inactive is not necessarily going to tell you what your active is, but the higher this is, the more likely you're going to be turning on more genes up to a certain point, probably 80, maybe, you know, they might find up to 100. That's a safe, you know, but in there, that's where you're going to get. Now, look at that compared to the RDA. Sun exposure, diet, or supplement. So you might say, well, okay, I'm going to take the latest research and I'm going to supplement my diet. Well, I want to show you that you can't get it all from a supplement. So you need to have sensible sun exposure. So non-vitamin D benefits of the sun. So the sun comes in and you make other beneficial compounds that benefit you besides just vitamin D. Number one, I'm only going to go through 3, but number one, you hit the skin cells with vitamin D. It produces nitric oxide, which vasodilates and can bring down your blood pressure when you're out in the sun. It also can break down hemoglobin. So if you get a bruise, go out in the sun and see if it goes away faster. Okay. UVR also comes in the eye, and it eventually can make changes in your hypothalamus to decrease appetite. So these things, if you're just taking vitamin D, you're not going to get a lot of these benefits. Now, here's some other benefits that you might not get. I just want to go over these because if you're a practitioner out there, you'll see the value in this information. UV rays come in. That's what makes your vitamin D, the UVB. Now, over here, here's the light spectrum that you see in a rainbow. Then on the other end, you have this infrared that you can't see. But it comes in and it actually benefits the skin cells. And that's why we've made things like infrared sauna and low-level light therapy that a lot of doctors will use in their practice for helping things with cramps, pain, sinus. Actually, it helps with sinus too, sinus pressure. So light waves have a lot of beneficial effects and not just making vitamin D. So I'm going to move myself up here. Okay, so in the winter, you want to supplement with more vitamin D, obviously, and I'll show you why in a minute, but obviously you're not going to make as much, so you want to supplement more with the winter than you do in the summer. Now, in the winter, if you're above this line right here, then you do not make vitamin D in the winter. So you can stand out naked and you will not make vitamin D. Okay, down here below this line, you will make vitamin D year round. Okay, Now, you need to understand something, that as the sun sets, less UV gets in because you need more of a direct shot to get the UV. The UVA still comes in, but the UVA won't come in. So a rule of thumb is, if the sun's here and it casts a shadow that's as tall as you are, then you're making vitamin D. But if you're getting the sun way back here and your shadow is going way out here, you're not making vitamin D. So that's a quick and dirty if you don't, can't find the UV index and you don't know. So the higher the sun is in the sky, the more vitamin D you can produce. Okay, so really between 10 and 3 is where you're going to produce the most UVB rays, which is what burns you, and it's what makes your vitamin D. Now let me move this down here. So over here, so how long do you have to be out in the sun? Well, that depends. If you're sunbathing, 20 minutes, you have a skimpy bathing suit on, and in 20 minutes you can produce 4,000, or the equivalent to 4,000 IU of vitamin D. Now 1 hour of jogging, because you have more clothes on and you're at a different angle to the sun, so less vitamin D. And if you're golfing, if you golf like I do, and you're in the trees all the time, you're going to need 3 hours to get the same amount. Okay, so I'm going to put this guy right up there. Now, you might go out in the sun and you say, okay, I'm going to put on sunblock. Okay, so the sunblock, most of them block UVB. So if you block UVB, it's actually the UVA that does a lot of damaging, aging, and wrinkling. So if you're using this sunscreen and you're going to block UVB, the damaging sun is still coming in. And if you block it all, then nothing comes in. You're not going to make vitamin D. Okay, so what's sensible? 30 minutes the front, 30 minutes the back, sunbathing. And then when you're a little bit pink and you can push on your skin, you feel a little redness, come in out of the sun. Or if you want to stay out all day, put a full block on there. Okay, now if 3 times longer if you're obese, because a lot of yours is going to the fat cells. You're elderly, you're producing it less efficiently, and you're dark skin, you're not getting as much UV B rays in. So these are the things to just understand if you're going to get from the sun. Now, I threw this in there. I'm not going to go into cancers, but I just want to show that, everybody's been scared of the sun because of cancer, but actually it's sensible sun exposure actually probably helps you with fighting cancers, as we've seen with the immune system. So I just wanted to point that out. So what level do you want to get in the blood? If we know we're guessing, so we're going to guess what level. Well, if you look at primates, they're at about 60. Okay. Now humans in the sun, they're at about 55. Remember, you're between 40 and 60, 55 humans in the sun. Now look at this. Americans in winter, you're at 15. Okay. You're taking 1,000 IUs, you're at 25. You're taking 4,000 IUs, you're at 40 on average. So maybe you're deficient. You're going to maybe prevent rickets if you're up in the 40 to 60, and you're probably turning on enough genes to, maybe prevent cancer. Or, it's going to be individual because we're measuring the inactive, not the active. Someday we'll hopefully measure the active on a wide scale. So you may be at 40, I may be at 25 and have perfect DNA expression. Everybody's going to be different. And so I'm waiting for the researchers to get on that to figure that out so that we can become more accurate. Now, so if you're going to guess, here's the things you need to understand. This is again from the Grassroots Health. Highly recommend their site. I don't have any ties to them, by the way. So 4,000 IUs, this is your level in your blood, okay? Some patients taking 4,000 could be way down here deficient. If you're on a lot of drugs, if you're, obese or whatever, a lot of factors can put you down here. Now, some people can be way up here in the 140. That's maybe where you want to be on 4,000. And then this doesn't necessarily mean that you're kicking on all your genes that you should be or you're not. It's just a good reference range. So on average, you're going to be at about 40 if you're taking 4,000, okay? Now, what if you know your levels? I'll put this over here. So what if you know your levels? say you're at 20, say you want to get up here 60 or above because of seeing this research, and you want to be in the, obviously talk to your doctor before you do this, but you know, you want to have the information yourself so you don't just go in there blind. But 20 nanograms per milliliter. If you want to get to 60, you need 10,000. If you're at 25, 10,000. If you're at 30, you need 10,000. So it's not incremental to get up to here. But do you see, if you want to get to 40, if you're at 10, you could take 6,000, 6,000, 5,000. So most people that are taking it are probably in the 4,000 to 5,000 range. You're probably only in the 40. So you're probably going to have to, you know, talk to your doctor and see if they want to bump you up on that. Can you take too much vitamin E? Well, they can put too much oxygen and that'll kill you. So yes, you can have too much vitamin D. Now let's start with our reference ranges. So everything's set 400 to 600 international units. So what does this mean? This means that they want to keep you at about 20 nanograms per milliliter. Now this is before all the genetic understanding and, you know, all this. So this is, you know, probably 75-year-old, you know, so they're not changing very fast, but they'll probably up it, you know, once they're doing a lot of genetic testing, they'll probably up this. But 400, 600 internationally only gets you to 20. Well, if you want to get above 30, you need, yeah, up to 2,000. So then you might think, oh my gosh, that's way too much. 2,000 to 10,000, that's a huge jump. Well, really, it's not. It's a sun dose, so it's not a huge jump. But my point is here, this is measured in micrograms. 1 million microgram equals a gram. So this is a very small amount. So when I go from 20 to 250 in micrograms, it's a small dose, very small dose. Now, why is this international unit? Well, I don't have time to get into it, but basically international unit was what it sounds like. They said, okay, if vitamin E prevents a certain thing in a rat and they weigh this much, then you know, a gorilla will weigh this much, a human will weigh this much. They wanted an international unit so they could just go up across the board based on weight. Well, that's the best they had at the time. So, you know, I'll give them credit for that. But now we know so much more that it's just kind of outdated. Okay, so again, you want sun exposures to get maximum DNA expression, but we're kind of guessing at that because we don't know. The level in the blood that's inactive is not necessarily mean we're all turning our genes on. So what's toxic? Again, this is grassroots health. I think this kind of goes along with most of the things I've seen out there. But if you're up to 30,000 international units, remember from the sun you can get 20. So you go up to 30,000, yeah, you might get some toxic levels in there, 30,000, 50,000 IUs. I'm not a big fan of just dumping a bunch of vitamin D in people to raise their lab values. I want to slowly put it in, so I wouldn't go up in these high numbers. That's just my own personal opinion. But my other personal opinion is do not take vitamin D2, ergocalciferol. I don't have time to get into it, but I wouldn't take that at all. Only take the vitamin D3, cholecalciferol. You know, that's from cholesterol. And most prescription are at the D2 level, and it's like pharmacology is the idea there. So I would take the D3, and also preferably take the D3 with vitamin K2. And I'm just going to go over that real briefly, but K2 allows calcium goes into the bone, not into the cardiovascular system. And so it also helps with promoting arterial flow and flexibility. That is big for avoiding you know, problems with high blood pressure and this and that. So definitely vitamin K2 beneficial for a lot of things, but I'm just going to go over just two. You know, I don't want to spend too much time on it. So in conclusion, okay, I'll put myself up there. Okay, in conclusion, vitamin D allows gene expression for increased body function. It's not a cure-all. It doesn't cure, treat, mitigate, or anything disease. It just allows your own body, if you have vitamin A and magnesium and all the other things, to fight a virus on average more effectively, okay? Vitamin D deficiency is related to many disease processes. And just understand, if you have a lot of diseases going on, you may need either higher levels, or because it may not, when you downregulate as many vitamin D receptors, you may not have the same level affecting you as much. So you want to look at that definitely. Adequate active vitamin D levels to maximize DNA expression. So now, as you can see, if you're not measuring each person's gene expression, you really can't make any conclusions other than the higher your vitamin D levels up to a point, maybe 80, 60 to 80 is probably where you want to be, maybe 90, but further research is going to tease this out and let us know where we really want to be. And each person will probably have their own level that they need to be at to have maximum genetic expression for a healthy response. For optimal function, you need the sun and supplements. You can't just get it from the sun. You need supplements as well. Okay, so I hope you've enjoyed this. We've just kind of hit the highlights, but I hope this helps you keep safe. And then again, if you want to hear more from us, just let us know. So I'll turn it back over to Shalise.
Thank you, Dr. Frank, and thank you for that presentation. It was very informative. I learned so much about vitamin D that I didn't know before, so thank you. This presentation was provided by Dr. Paul Frank on vitamin D, so please like this video and subscribe to this channel if you found this information helpful, and Dr. Frank will continue to work on developing more content for you in the future. I hope you have a wonderful day, and thank you for listening.
Thank you very much, and stay healthy, everybody.